My name is Martha, and I would like to talk about medication errors. You might ask yourself, what is a medication error? Well, a medication error is any kind of preventable event that may cause or lead to a misuse of medication or harm to the patient. There are a lot of causes for medication errors. I have listed some of them. The human factor, which basically means we're all human and we all make mistakes. Systems. There could be one system used in one hospital and another one in the other hospital. Abbreviation. Abbreviations can cause a lot of errors. Oral orders. So as far as I know, you cannot take an oral order. You have to have a written order in the computer. Look-alike and sound-alike drugs. Dosage calculations. Dosage calculations are very important because you could kill a patient with insulin, for example. So what the nurses do now is they kind of double check each other, and they have to sign off on the insulin amount for each other, and at-risk drugs. So the Johns Hopkins patient safety experts have calculated that more than 250,000 deaths per year are due to medication errors. Adverse drug events, including medication errors, cost us more than 3.5 billion each year. So why are there medication errors? Well, one of the reasons for medication errors is that there are a lot of distractions and interruptions in the clinical setting that kind of shift away the focus from the actual task. There is a study published by John Westbrook in the Archives of Internal Medicine that states that any kind of medication error increases by 12.7% with each interruption, and the risk of a harmful medication error is doubled when nurses are interrupted 4 times and tripled when they are interrupted 6 times. So what kind of distractions are there in the clinical setting? There is a wide variety of distractions, from the call bell, the phone ringing, a patient asking you a question, and the physician asking a question, the nurse, the other nurse, receptionist. So there is a lot of room for distractions. So a British Journal of Nursing published an article by Fry and Dacey in 2007 with the title Factors Contributing to Incidents in Medicine Administration. And so while surveys suggest that health professionals often believe that telephone calls and patients represent the greatest sources of interruptions and distractions, actual studies have found that self-induced interruptions, during which health professionals themselves initiate conversation with others, is a more frequent source of interruptions. So this means that if you are giving out medications and you are talking to another nurse, this makes you more prone for error. So what can be done about those constant interruptions? Well, a lot of hospitals have started to implement steps to help with those distractions and with the medication errors. And some hospitals have created a no interruption zone. A no interruption zone is kind of the concept of a sterile cockpit in which a discrete area is taped off with red tape or any kind of visual markers, and it basically means that whoever is in this area should not be talked to and not disturbed, should not be disturbed. It's also very important to educate the whole staff, healthcare staff, on this problem, and so that everyone knows that those steps should be taken and that nobody should interrupt the other healthcare worker while they're performing those important tasks. So the conclusion of my presentation is that the amount of errors can be significantly reduced if we become more conscious about how important it is to not interrupt your coworkers or to not interrupt or to not be interrupted by anyone. And so, for example, if somebody comes over and tries to talk to you, say, hey, I can't talk to you right now because I have to do this important task. So a medication error can really decide between death and life. And so we really want to make sure that we do everything in our power to prevent those.